Hi, this is Dr. Mora. I wanted to talk to you about pectoralis major tendon tears. That's an MRI. This is a diagram, but before I do so, first of all, I wanted to say thank you so much for following me on social media. It really means a lot to me. I'm humbled by it, and I hope that because you do take time to follow me, I hope that I am providing valuable information for you, and hopefully it will help you and guide you with your own health. This is what I want to talk to you about briefly because there are a couple of very important points. And if you know anyone who does bench press and does a lot of bench press, forward this video to them because I think it may have information that might help them in the future, especially if they get injured. Pectoralis major tendon tear, one of my favorite tears to repair. Pectoralis major, two heads, one off the clavicle, one off the sternum, attaches to the proximal humerus, right next to the biceps. That's a very important point, and I'll mention why in just a second. Typical mechanism, bench press or lifting something. It doesn't always have to be heavy. The person will feel a pop. Why do they feel a pop? Well, look at this tendon. I mean, look how big it is. It's a big fat tendon. It's about an inch broad. It's not very thick, but it pops. And as soon as it does, it bleeds. Why does it bleed? Because there's a lot of muscle nearby, and the muscle has a lot of vascularity. Okay, this is the most important point to remember here. The bruising does not occur in the chest wall. Actually, very rarely occurs in the chest wall. It actually tracks down the arm. Why does it do that? Because, like I said, the biceps muscle is right here, and the biceps tendon is right here, and it creates a track. So it bleeds right here, and the bleeding goes down the arm. Usually right about here is where it pools. So if this is what happens, or you see this happen to somebody and they have bruising on the arm, just say, hey man, that's a pectoralis major tendon tear, most likely. So the next stop is the orthopedic surgeon, or even an MRI of the chest wall first. So take home point number one, bruising of the arm, pectoralis major tendon tear. This is the cross-section of the MRI. So cross-section, because we're looking at a patient as though they're lying down. This is the right lung field. Skin, a little bit of fat, a muscle belly. This is a muscular patient. So this is what we have. We have a muscle belly right over here, and as you can see, it kind of ends like a stump. You don't really see a lot of tendon here because the reality is there is not a lot of tendon there, and that is the problem. An MRI is done. You don't see a lot of tendon. The patient will go to the orthopedic surgeon, which is the right thing to do with this MRI. The MRI will probably say tear the pectoralis major tendon at the musculotendinous junction. That's the key word, musculotendinous junction, but unfortunately that's the operant word that leads to no treatment in many cases. So that's the third take-home point. The second one was get an MRI. The third one was if the MRI shows or the impression is musculotendinous junction tear, and the orthopedic surgeon says, hey, I'm sorry, I can't fix this because the muscle is too mushy and the sutures will pull out. Unfortunately, that's not the usual case. There's always a little bit of tendon remaining. I say always because in my experience there's always at least 5 millimeters or maybe 7 millimeters of tendon, and there's actually a little bit more. It's hidden in the muscle. It's hidden underneath right over here. That's probably a little bit right there, enough to do the job. So if that's the conclusion that you receive, that you cannot fix it, and that's what the orthopedic surgeon says, I respect that. I respect that opinion. It's in the books. But the reality is that there is tendon, and you don't know that there's tendon until you do the repair. So what guides me in my treatment? The activity level of the patient, the deformity, how it happened, and what the patient needs are. In most cases, patients want to have a symmetrical looking chest wall, and they want to have the power that they used to have. They may not go back to bench pressing, but they'd like to have it repaired, and that's what I usually do, and that's what usually happens when patients see me, even when it's, believe it or not, 2 years out from injury, maybe even 3 years out from injury, because there are ways to fix it, and that's what I want to let people know who have this. There are a lot of people out there that are walking around with a deformed chest wall. Sometimes it's quite unsightly because there's a band of tissue that sits there. there's a band of tissue, and a lot of people don't know this because there's some fascia that attaches the pectoralis major to the biceps, and there's this band that goes across the chest, and you can look it up online. Just Google pectoralis major tendon tears chronic, and you'll see these pictures of this strange band that's attached. That's actually a fascial band that goes to the biceps. So that's the situation that usually happens. A lot of people are walking around with chronic pectoralis major tendon tears, and they don't know that there's actually a solution. There are ways to reconstruct it, to recreate the contour, recreate the lateral border of the chest wall, recreate the symmetry, and reestablish some of the power. It may take a long time to reestablish the power in a patient that's had a tear for 2 years, but it's possible, and that's the message that I want to give. I want you guys to know, I say guys because it usually isn't guys, that if this is the situation and you've lost hope because you've gone to 1 or 2 guys that say, no, I'm sorry, I can't fix it, there is a way to fix it. Pectoralis major tendon tear reconstruction using allograft Achilles tendon. Then I've posted some videos on YouTube as well as Instagram. I'll be posting another one very soon. I just did one a couple weeks ago, and it helps. So once again, to recap, bruising of the arm after a pop, mushy chest wall, pectoralis major tendon tear. What do you do next? Get an MRI. If the MRI shows a tear of musculotendinous juncture and the orthopedic surgeon is not confident about the repair, you may want to find another orthopedic surgeon that is. And lastly, if you have a chronic tear that is creating a mental duress on you or weakness, there may be a way to repair it, and that's using an allograft. You guys take care. Sorry about the long video, but it is something that I love to talk about, and I can actually talk about this for a very long time. You guys take care. Dr. Mora here. Be safe, be strong, be kind, be compassionate. You guys take care. Thank you.